And our next speaker is Tabitha Perry, the duty to warn at-risk relatives of experience of genetic counselors in medical genetics.
Genetic testing is unique from other medical tests in that it reveals information about your biological relatives. For example, if your sibling tests positive for a harmful genetic difference, which predisposes her to sudden cardiac arrest, there is a 50% chance that you carry that same harmful genetic difference. Do you think you have a right to know the results of your relative's genetic testing? What if having that information has the potential to save your life? The duality of genetic information, in that it is both familial and personal in nature, has been a source of debate in the medical community and raises a very important question. In the event that a patient refuses to inform their relatives of their genetic risk, does the healthcare provider have an obligation to those relatives to inform them of their risk? To answer this question, we can first look to professional guidelines. The American Medical Association and the National Society of Genetic Counselors state that patient confidentiality is absolute. These professional organizations cite the ethical principle of autonomy and the importance of a trusting patient-provider relationship. In the event that patient confidentiality is conditional, it is feared that patients may withhold important medical facts or even reject genetic testing altogether, even at the consequence of their own health. Alternatively, the American Society of Human Genetics says that while confidentiality should be the default position, in exceptional circumstances, it is permissible to release a patient's genetic information even without their consent. So, when we think about, we can also look to laws for guidance. Typically, state and federal laws operate under the assumption that genetic information is exceptionally sensitive and requires additional legal protections. However, even under these laws, patient confidentiality is not absolute, especially when there might be inevitable harm to a third party. In 1996, the New Jersey Supreme Court ruled that compared genetic information to basically what I mean is there are different laws saying different things. There's really no consensus about what genetic counselors, what geneticists, what healthcare providers are obligated to do in these types of situations. So, should we value patient autonomy over the patient's relatives' well-being? There are no clear answers to this question. My research seeks to understand if, how, and when genetic counselors and geneticists, the medical providers at the heart of these issues, experience this conflict of obligations in the clinical setting. These experiences must be brought to light in order to affect policy and to best serve our patients and professions. Thank you.